Thank you so much to everyone who reached out in the past 24 hours. I don't think we've got as many emails in a day as we have in the past day. Now, the way to send an email to us is paul@skynews.com.au, but there are lots of other ways, and some people remember my personal email address I used to give out on the air before we had paul@skynews.com.au, and I got flooded. Lots of people, lots of messages, lots of Facebook, and all of it was in and around the difficulties in and around mental health and how this country needs to put front and centre it as big a priority as trying to cure cancer. The child psychologist, Claire Rowe, was very supportive of what we had to say, but equally said it's not just about money. Well said, well done. We'll have a chat to her in the next few days about it. And lots of people told us their version of the story about how the system sometimes worked but mostly didn't work, or they didn't interact with it, or there were even some people who reached out to tell me that I was the first person that they were telling about a certain story. To all of you, thank you. It is not lost on me how much strength that takes, and it is not lost on me the honour in which it was that you put your trust in me to have that information. I look forward to replying to all of those messages over the next couple of days. As anyone knows, even my family, I'm not the world's best at returning phone calls or text messages, let alone emails, but I will to all those people that told beautiful stories. But there's a couple of other extensions to the story that I wanted to bring you tonight, which was that cost of living, the obsession of this program, because it is the focus of the nation, does have an effect on the amount of people who just don't have the cash to go and seek some of the support that may well help them deal with whatever is going on. Psychologists say that patients are unable to access their help because of rising costs, and shortening wait lists are being triggered because people are simply unable to afford psychological care. In April, a survey by the Australian Psychological Association found that more than 40% of psychologists reported costs as the main barrier for patient access. The President said that psychologists were reporting their shortening waiting lists were a result of patients simply not accessing their services. Patients currently face putting food on the table and paying their rent rather than dealing with mental health. And there were a couple of people who seemed to doubt what I was saying about the government and the access to the telehealth system. Now, generally speaking, this is mostly used for access to your GP, but for people when it comes to mental health, that is the first step sometimes on being able to work out which way to go, and it's a really valuable and important step. Now, at the height of COVID, when people physically couldn't go to the doctor because they weren't allowed to leave their house, you know, all of that nonsense. Well, 10 free telehealth visits were available to all Australians. Then this government came to power, and of course, one of the first things they did was to announce that this was going to start to wrap up. At the time, there were plenty of things where vulnerable Australians were filled with dread over the potential telehealth cuts. The government decision to limit telehealth services will make vulnerable Australians suffer more, said the GPs. Now, this was put back ever so slightly for some people in regional areas, but in terms of automatic access, it is no longer the case. This must be changed. Tomorrow there'll be a meeting of all of the mental health ministers around the country. I hope they come up with the opportunity of finding ways for more people to get free access to, at the very least, their GP or other services to be able to make sure that you can start a journey that I hope is as fast as possible. I hope it involves as little medication as possible, but the reality is for some people it will be long and it will involve medication. But I want people to be able to be taken care of. And in the same way, we don't want to ignore the lump on the back of your neck. I don't want you to ignore the lump that may well be in here because of what's going on up here. We'll all find out what happens in a meeting, but when these things happen on Friday and they normally go for 2 hours, the agreement has probably already been made. But of course, I've done my best to try to bend arms in the past, loudly on television, but I will try to continue to do so quietly behind the scenes. This is an important thing that needs to be done. And yeah, I'm going to link this back to the cost of living stuff that I've talked about over the past, few years. Because you see, when a government turns around and takes $1,500 automatic tax returns off people, like this government did, in their first budget in 2022, it meant that there was $1,500 automatically taken away from families that may well have been able to be spent on reaching out for the correct services. It was, of course, the low to middle income tax bracket, as it was called back then. Both sides of politics were committed to it. As I said, if the Liberals had been returned, I would have been not bending arms, but I would have been making sure that this would not have happened. But Labor, they don't care what we think. Well, they'll find out what the reality of that and ignoring what we've been talking about will be at the upcoming election. But even the Australia Institute noticed 10 million people get screwed over here, and if you don't have $1,500 to be able to go and seek out services, this is what some people are use with that $1,500. That's why the smartasses in Canberra who thought, let's just take the $3 and a bit billion that would automatically be the $1,500 thing, and we'll move it over to student debt, because it doesn't really cost the budget, but it's more politically advantageous over here. 10 million people should still be getting access to that money as a way of being able to keep themselves afloat.